watching Let's Chat.
The big story making health news recently has been the coronavirus. We wanted to find out more about this, so we turned to one of the preeminent infectious disease specialists here in Chattanooga. It's Dr. Jay Sizemore. Dr. Sizemore, good morning. Thank you for sharing some time with us. Exactly what is the coronavirus?
So the coronavirus that everyone's talking about right now is a virus that crossed over likely from a bat into the population of China and has spread rapidly across China and many other countries across the world. Coronaviruses, there are many coronaviruses. Coronaviruses cause the common cold, but it's when one of these new viruses cross over into the human population that it raises some trouble. Some people may remember MERS, the Middle Eastern Respiratory Syndrome, or SARS, the severe acute respiratory syndrome. Those were both coronaviruses that hit us, I guess SARS 2003, MERS 2012. So this is a very similar outbreak that we're experiencing right now.
How dangerous is this coronavirus?
So I think it's dangerous. I mean, it's hard to quantify that, but just purely by numbers, 28,000 cases of this novel coronavirus have been reported to date worldwide, with over 500 deaths. So about 2% of people that are being identified are dying from the virus.
As an infectious disease specialist, does this scare you?
It scares me, but I'm cautiously optimistic, primarily because of the aggressive but appropriate actions that the CDC has taken to help protect U.S. citizens from the virus. If I were in mainland China right now, I would definitely be scared. In the U.S., we've had 12 reported cases. We've tested about 300 individuals so far. So it hasn't hit us hard yet. Certainly without appropriate public health intervention, we could be in for a lot more cases as well.
If someone were to walk into the emergency room at Erlanger and they met the case definition for coronavirus, what would your next steps be?
So we've worked very closely under the instructions of the CDC with our local and our state health department, and we would respond accordingly. The first thing that we would do is we would place a mask on that patient, and then we would place them in an isolation room, and then any healthcare workers who would go in there into that room would be heavily garbed in a gown, mask, eye protection, and then that patient would remain in quarantine for 14 days to try to prevent spread to other individuals.
Are masks like these helpful? Do they hurt? You see a lot of people wearing these in airports.
Yeah, I think certainly they don't hurt. They look kind of funny, but they don't hurt.
Right.
I'm not sure, at least at this point in the U.S., we're at a point where we need to be advising, and certainly no one is advising, that if you were to fly or go out to a shopping mall that you need to wear a mask.
You mentioned that most likely this virus originated from a bat transferred into a human contact. How is it spread from human to human?
So again, the original outbreaks described in a live animal market in Wuhan. A lot of the first cases felt to be transmitted that way, but as far as human-to-human transmission, at least what we know about the virus right now, it seems to be primarily through respiratory droplets. So you have a cough, you generate droplets out into the air, another person inhales those.
Some of these numbers you mentioned a moment ago are kind of staggering. You said 28,000 confirmed cases worldwide. That's more than the population of East Ridge. I mean, these are big numbers, and these are real fatalities that we're dealing with on this. What can we do, or is there anything we can do, a matter of prevention on a day-to-day basis?
So I think it goes back to what we should and could be doing for influenza. So right now, in my mind, influenza is a much bigger threat than the novel coronavirus. So washing our hands, covering our mouth, not going out if we're sick, and then most importantly, there's still time to get the influenza vaccine this year. So those are the things, it's just common sense things that we can do to prevent person-to-person spread.
We have about 1 minute left, and I want to shift from coronavirus to the flu. You're a big proponent of the flu vaccine, correct?
Correct.
Is it too late?
It is not too late. It is not too late. We're still in the midst of flu season. It's been a fairly severe flu season. We've seen people die in this community of influenza.
Repeat that. In this community.
In this community. Many people have died of influenza. So we have tens of thousands of deaths every year in this country from influenza.
And it seems
We've
like
had 12 cases of the novel coronavirus. We need to be focusing on the flu.
It seems like we've kind of gotten used to people dying from the flu, but there are proactive measures that we can take. Dr. Jay Sizemore, thank you so much for sharing your time and your expertise. We hope you will come back in the future. If you want to find out more, let me share some information with you about how to find out about the flu, about the coronavirus. It's right there on your screen. Check out the Center for Disease Control. We have got much more of Let's Chat. We'll see you tomorrow morning starting at 10.